So our first question, how important is body contouring and skin tightening to your practice compared to your other aesthetic concerns? Jason?
You know what?
No, first Jason. Okay. Young Jason.
This is gonna be a tough one. Both of us on the same side. It's very important actually because the majority of my practice is doing body shaping. I would say, I have a significant component of patients that come in looking for body contouring non-invasively, but since I do a lot of invasive body contouring, I end up sort of looking to their entire body and looking at them as a whole in terms of shaping and contouring. So a lot of times we end up doing a more of a surgical modality and following it up with non-invasive procedures that enhance the result to get more tightening and improvement of cellulite from there.
Great. Jason Pozner, how important is this to you?
We've talked about this a lot over the last bunch of years. So I'm going to quote Larry Bass for this, one of our close friends. And Larry says, we have a slide in my talks like this. This is the holy grail of plastic surgery. Okay, if we can shrink skin and tighten the skin without cutting skin, I think that it's better for us and it's better for our patients. That's the holy grail. Are we there yet? No, we're getting there though.
Okay, excellent. Barry.
Extremely important. ASAP stats show 83% of treatments are non-surgical, and these are huge portions of the non-surgical, the body and the skin, and I think these technologies are getting better, and the continued research is going to make that so, and it's a huge part of what we do, and to our patients as well.
Andrew?
I would use the words that it's extremely important to the future of my practice, considering that non-surgical body contouring is the fastest growing segment of the aesthetic market. And that's one of the biggest reasons that I kind of jumped on board. I thought that the devices were getting visible and consistent results in a safe manner, in a way that I didn't have to do it. And as a facial plastic surgeon, I don't operate below the clavicles unless I'm just grafting or getting fat to fat graft. So I think it's very important as I build the business, but in my personal practice, it's a very small part.
Michael?
And again, as a facial plastic surgeon, the body contouring for me, not that important. I usually refer most of that to my plastic surgical colleagues, but it's nice to have something non-invasive for that part when patients ask about it. But for the skin tightening for the face is essential to my practice.
And I think it's important to mention, a lot of people have the misconception that the non-invasive, the non-surgical body contouring, like cool sculpting, would reduce my liposuction practice. Actually increase. So that's a misconception. And I think it's the same for you too, right, Grant?
Actually, to the contrary.
Good.
67% were new patients, 62% of them never had an aesthetic procedure, and 40% of them stayed with the practice over 3 years. It built the surgical practice.
Perfect.
Actually, speaking of that, Renato, why don't you share with this crowd the 747 effect and why they should be embracing non-surgicals?
I don't have that slide, but I can tell you...
I know you can do it without a slide, Renato.
I can tell you, well, I like to show the Delta airplane.
I know you do. Imagine an airplane coming across the screen.
I can tell you...
See the airplane? Okay, now Renato.
We studied this in 2007. For 2 years, ASAPS did a study where we look at what the public, our patients wanted. And when we ask potential plastic surgery patients, we interview 2,500 patients, potential patients all over the US. And when we ask them, how many of you would pick a plastic surgeon for your procedures? About 93% said, for a plastic surgery procedure, I would pick a plastic surgeon or a facial plastic surgeon. And then when we ask the same group, how many of you, after a successful non-invasive procedure, let's say you saw a dermatologist, you saw a non-plastic surgeon for a non-invasive procedure, fillers, Botox, about 47% of those potential patients answered they would stay there for their plastic surgery, for their surgical procedure. So we came up with the 747 effect, meaning regardless of your specialty, if you don't capture these patients early with non-surgical procedures, they're probably not going to come back for surgical procedures.